Hi, my name is Kelly Henry. I'm a registered nurse and a certified diabetes educator, and I work for the Center for Excellence here in Northampton, Mass. I'm going to be talking today about how to reduce high blood sugar. How to reduce high blood sugar once it started is really we need to stop and look at what's going on in the lifestyle. Has anything changed in our lifestyles? Had you changed your activity level? You're doing less activity? Have you increased what you're eating or eating different foods? Or maybe you've started adding some snacks in there. One thing we can do first is to test the blood sugar to see where the blood sugar is, when it's happening. Is it high all the time or is it just high after meals? So that might be an indication that it's the food that we need to look at. Maybe we've changed our meals. Sometimes what we'll find too with people when the blood sugar goes up is because they've been ill and or under a lot of stress, emotional or physical stress can raise the blood glucose. And if people are under stress or they're physically stressed, the blood sugars can go up during that time. And sometimes when the illness or the stress, whatever kind of stress it is, goes away, the blood sugar doesn't necessarily come down. Diabetes, type 2 diabetes is a progressive disease, and sometimes these are the things that kind of push the edge and make the pancreas slow down in its production of insulin a little bit more, and we need other means to lower that blood sugar. This is a time if you find that your blood sugar is elevated for more than a week, and I don't mean it has to be high yet. It doesn't have to be in the 200s or 300s to be calling the practitioner. Could be that the blood sugar has always been in the 130s 2 hours after meals or right around there, and in the morning you're between 80 and 100, and all of a sudden you're finding that you're in the 120s, 130s fasting, and 2 hours after meals you're in the 150s, 160s. You might want to call the practitioner and say, look, there's been a change in my therapy or a change in my blood sugars. Do I need a change in my therapy? It's a good idea to keep on top of it because each increment that goes up, it's a lot of times very hard to get it back down with the same therapies that you've been doing. If it was that you changed your activity, then look at changing back to where you were. But sometimes you need to add a little bit more. If it's that you've changed your meal plan, then you may want to go back to what were you doing? Or did you add a snack in that you don't need? Why did you add the snack in? So really look at the behaviors that might have changed, and or, like I said, if it's illness, stress, and the stresses have gone away, or even you've changed back to the meal plan that you were in before, and yet you still find that the blood sugars are elevated, this is a time that you may want to be calling the practitioner and saying, look, my blood sugars are up a little bit, I've gone back to what I was doing, or I've changed, or my stress is gone, or I'm under stress and I can't get rid of the stress. What can I do about it? But don't sit on it. I think one of the most important things with high blood sugar is not to wait very long. Give it a week at most, and if you're seeing these changes, definitely rethink your lifestyle, look at what's going on, what did I change, test, see where the changes are, and then call the doctor. Make sure, or call your practitioner, whether it be a doctor, nurse practitioner, or physician's assistant, see what they have to say. What can we change in the therapy?